Starting the webinar now.
Good afternoon and welcome to the Secure Webinar Series number 7, the Health Communication Momentum, How Do We Accelerate? My name is Randy Dakanay. I'm currently the Senior TA Coordinator for the Secure TA, which is supporting this webinar. And there's so much to talk about on health communications. It has been like almost 4 years now since the pandemic started, and we have relied on health communication for information on what the disease is all about, treatment, prevention, and including the vaccine development and deployment for COVID-19. Today, we would like to look into what has happened as far as what has been the impact of an effective health communication for prevention and addressing COVID-19 and future public health emergencies. We look at has there been changes in the health communication strategy, and what kind of investments are needed to further accelerate, further strengthen, and make sure that the health communication programs and policies are would easily address future pandemics. So to start with, I'd like to introduce to you the project officer for Secure TA. He's currently the principal health specialist for Southeast Asia Regional Department. He's a champion of universal health coverage. Dodo Banson, as he's known. Before joining ADB, he was also the president and CEO of the Philippine Health Insurance Corporation. He was WHO Regional Advisor for Health Financing for the Eastern Mediterranean region. And he was also a World Bank Senior Health Specialist. And currently, he's the project officer of Secure TA 6767, supporting enhanced COVID-19 vaccination and post-COVID-19 health security response in Southeast Asia, or what we call a Secure TA. Dodo, your turn.
Yeah, thanks a lot, Randy. And first of all, thanks for all the resource persons, the speakers that, of course, thank you, Ayako, for gracing this and opening this later. So okay, sorry. So the Secure TA is ADB's technical assistance. It's a regional technical assistance project of the Asian Development Bank designed to help countries, developing member countries in Southeast Asia, initially in the deployment of COVID-19 vaccines, but also subsequently strengthening our regional health security interventions. The Secure TA has been helping all of the developing member countries here in ADB, providing country-specific support on everything from pharmacovigilance to looking at public-private partnerships on how to strengthen health security, health communications, of course, are a big part of any discussion on health security, and a lot related to that, including strengthening response capacity at the primary care level and the hospital care level. Webinars to look into specific topics from health and climate change into digital health, and of course now something which we are really been supporting strongly, health communications. So we have seen really during the pandemic emphasis on the value of health communications. We have seen countries investing a lot in health communications, and I think we're here to listen to the experiences of our experts from WHO, from experts from Thailand, from the Philippines, to listen on how these investments have been made, how we can help sustain that, how we in ADB can come in and help our country, our member countries, continue to invest and probably even expand whatever in investments in health communications. So we thank everyone again and looking forward to listen to this very interesting topic. And so Randy, floor is yours.
Thank you, Dodo. This time to give us the welcome remarks, as someone who's been heading our division, I'm happy to introduce her to you. She's the director of the Southeast Asian Department, Human and Social Development Division. She leads the planning, implementation, and supervision of ADB's lending and non-lending operations in the social sector. That includes education and skills development, social protection, and health. She's also the chair of ADB's health sector group, where she guides the preparation and implementation of the health sector group work plan. Friends, we have Ms. Ayako Inagaki. Ayako, for your welcome remarks.
Yes, thank you. Thank you very much, Randy and Dodo and everyone. I think Dodo has made a very good, welcoming remark already. But any case, from my side also, I just wanted to thank everyone to participate in this very important seminar, where we aim to provide a video to discuss the very relevant issues on health communications, and particularly learning from this, of the COVID-19. So as Randy said, now, it's surprisingly, we entered the 4th year since the COVID-19 was declared a global pandemic. As all of us remember, the first year was really characterized by a lot of uncertainties, anxious, and people were really anxious. The second year was really challenges related to the introduction and the mass rollout of these new vaccines. But when we enter the 3rd year, we had to start battle. People have become complacent, and the resulting lack of actions, not only from the public, but also, unfortunately, among the government authorities themselves. So, what are really the lessons that we have been learning? So I think it's really about the very important role played by health communications in the prevention, preparedness, and response that needs to be really highlighted. And we did witness how much recognition had been translated into increased investment of government in this area, from human resources to the critical tools. They needed to have teams of trained communication practitioners to do the job. They also needed to establish the operating procedures for internal and external communications. And furthermore, they needed to develop mechanisms and tools that would make communicating risk to the public to be much more effectively handled. So all these needs have mainstream health communication in all the public health emergency management sphere. And consequently, it has given the said technical area a seat on the table and a big voice in the discussions. And most importantly, it has helped in increasing the resources. So the non-government actors had also stepped up from the donor organizations, the civil society, and the community-based institution, the academe, the individuals, and many, many more have come. So these people had offered the expertise, the influence that they have, the platform and resources to complement and supplement the government investments in health communications. So now on the 4th year of the COVID-19 pandemic, though the situation has become relatively better, we still cannot let our guard down. So the threat remains, with some countries again experiencing increases in cases. In addition, the COVID-19 vaccination program is not yet over, with many areas still unreached, especially in low-income countries, and millions of booster doses were either wasted or left unadministered because of the vaccine hesitancy, the health system-related challenge, among others. So for this webinar, we invited key resources speakers that would help us understand the landscape of health communication investment from the start of the pandemic today, and how this current COVID-19 situation and the required health communication capacity should guide further investment in the area. So we thank you very much, particularly, the speakers taking time out of their busy schedule today to be with us in this webinar and to provide and share with us their expertise and then the valuable insight on this topic. So again, thank you very much for your participation, and we look forward to the fruitful discussions. Good afternoon.
Thank you. Thank you so much, Ayako. Now, we have designed the webinar in such a way that we look at first the global direction of risk communication, thrust, and if there will be new strategies. And then we will look at the national level, featuring Thailand, and at the sub-national level, the city of Navotas. So to start with, we have two resource speakers, experts from the WHO BPRO Regional Office for Western Pacific. First is Ms. Lika Visser. She's the Risk Communication Officer, and she's the technical officer of the World Health Organization. She leads the WHO risk communication work and has been involved in the COVID-19 pandemic response as part of the within the COVID-19 incident management support team. And together with her is Anna Birnat. She's a communication officer also with WHO Regional Office for the Western Pacific. Anna supports strategic communication activities and plans to achieve better health outcomes. Since the start of the COVID-19 pandemic, she has been actively involved in the planning, implementation, and evaluation of the regional COVID-19 communication strategy. So, Anna and Lika, thank you so much. Your turn.
Thank you very much, Randy. It's a pleasure to be here today with you, and thank you for inviting us to present. So I will now try to share my screen. Can you please confirm that you see my screen? Yeah?
Yes.
Okay,
Yep.
great. So today, together with Lika, we will be talking about our COVID-19 communication strategy in the region, including specifically focusing on COVID-19 vaccination communications, and how they have been guiding and shaping our approach to communication moving forward. We will also talk about what we call a communication for health approach, which is something that is a big priority for us in this region. Here's a short outline of this presentation. So we'll start by a very short introduction to our region, our approach to communications from like a broader perspective. We'll talk about our how our response to outbreaks and emergencies, including COVID-19, looks like, and then we'll discuss COVID-19 vaccine communications and the momentum of COVID-19 to scale up communication and communication for health approach in the region. So I'm sure many of you know this, but just in case, I mean, the Western Pacific region that we represent as part of our work for WHO Regional Office for the Western Pacific is home to around a quarter of this Earth population. We are working with 37 countries and areas in the region, including some of the most populous countries in the world, such as China, as well as some of the least populous countries in the world, including some Pacific Island countries. So we are a very diverse region. And some of the key areas of our support to member states include building health systems for all, fighting communicable diseases, addressing non-communicable diseases, supporting response to outbreaks and emergencies. We also offer tailored support to the Pacific, and among other areas. So this is just a very short intro. And as you know, this region faces many health challenges, some of which have worsened because of COVID-19. And so in line with our vision for our work with member states and partners in this region, which is called For the Future, we are implementing and advancing the implementation of communication for health. It's an approach to communication which we recognize as a technical tool to improve health outcomes and deliver better health impact for people across this region. I mean, communication for health is not a new area of work. It's more of an approach which recognizes that health communication can play a vital role alongside other public health interventions to improve outcomes and extend lives. C4H, which is how we call it, builds on a range of disciplines and strategic communications approaches that have been used over previous decades to inform and change attitudes and behaviors and help improve health at individual, community, and societal levels. Essentially, what we mean by this approach is strategic communication, which is evidence-informed and uses insights from behavioral sciences to identify and achieve clearly defined outcomes. And C4H works with other programs to support implementation and achievement of shared goals. So we do recognize that while communication alone cannot usually solve complex health challenges, it is an essential element of most solutions. So as you can see on this slide, C4H is all about health impact. And actually, when you look at the word impact, there are 6 letters that kind of define and describe some of those key principles around C4H. So I stands for informed by data and theory. So the approach uses theories from social and behavioral sciences to diagnose the barriers and drivers of a health issue. We advocate for strategies to be designed around evidence rather than assumptions to address individual, sociocultural, and environmental influences. M stands for measurable. We use measurement evaluation methodologies to assess outcomes and impact of activities and apply those learnings to future activities. And that's something that we've been doing with COVID-19 communications. P stands for planned, meaning that programs follow a planning cycle to understand, plan, develop, test, implement, evaluate, and learn from the communication strategy. A is audience and people-centered, meaning that we use or encourage to use bottom-up approaches where audiences are not just the subject of our communication, but also originators. And we encourage this two-way process to ensure that community norms, attitudes are listened to and understood. C stands for collaborative. We understand that we can't do it on our own. We work with partners as part of multi-dimensional and intersectoral health actions. We draw on broad technical expertise, which we at WHO don't always necessarily have And this is why we work with partners and engage partners and community stakeholders in this approach. And finally, T stands for targeted, meaning that this approach uses communication principles and processes to prioritize audiences for a specific purpose based on known needs and preferences. I'll now hand over to Lika.
Thanks, Anna, for walking us through the communication for health approach. So within this approach, we emphasize that when we're dealing with emergencies, it's important to understand the risk perception. Communities are considering their risks according to different matrix, and the actual risk of the medical reasoning for risk and approaches might not be in line with what the community perceives as risks for their own health. And considering those actual and perceived risks, there is people's views of their risk is really the reality that we need to work with. So in our work, we'd like to refer to one of the strategies for effectively communicating risk by Peter Sandman. He has produced an easy to grasp overview of how to deal with people in emergencies, because he says that there are certain organizing principles. How big is the hazard, and also what level of outrage or anxiety is produced by that risk. So in order to ascertain also the response, understanding the perceptions or behind the risk is very important. And there are a number of factors that weigh into that. So just as an example, is the hazard voluntary or involuntary, familiar, unfamiliar? With COVID, we saw, of course, that the hazard was very unfamiliar, and therefore there was a high risk perception, and this changes over time. So the strategies that are deployed are organized with such a way that we understand the communities and are able to tailor our approaches according to how people perceive their risk. Next slide, please. When we were responding to COVID, and especially looking at COVID-19 vaccination communication challenges, first and foremost, we saw that there was a huge volume of information because people didn't really know too much in the beginning, and then at some point more information was being shared. There was this volume of information that people needed to process, and through that information ascertain their risk and determine how they felt around that. There were also different stories circulating and people talking about the vaccine and what kind of side effects it had, what happens when you take it, and people were sharing their own personal experiences and stories. And although this is very effective, we also needed people to understand that vaccines are safe and that they're effective and the best public health tool that we had to combat COVID-19. So this community sharing really also influenced people's risks, perception of risk. We all know that there was evolving evidence and data around what was effective, which variant, which vaccine was necessary. So all of these factors through the different phases of the COVID-19 response needed to be considered. Once the vaccine was available and the rollout for it, as WHO, we provided a roadmap put together by our SAGE committee, which highlighted who needed to be prioritized. And within that, sometimes it was confusing where the priority would also need to go to the elderly and healthcare workers, but it was being made available to the general public as well. Like there were a lot of questions around who was getting it first, how it would work for the first dose, second dose, and potentially the boosters. So really the approach of the government and how member states were communicating this to the public was very important. We also needed to be able to communicate to the vaccine demand and supply angles where there was overwhelmingly a lot of demand in some countries, whilst in others there was less demand, and how that linked with the available supply of the vaccines and the different brands and things like that. So the government needed to really look at how we communicated around the uncertainty of the evolving supply line and things like that. Right now, we're also seeing that there's a fatigue and apathy towards COVID-19 vaccination, especially getting booster shots. So the teams are working on addressing this challenge by strong communication to highlight the importance of getting vaccinated. Next slide, please.
Thank you, Lika. So it's back to me. So in this very challenging environment that you have just described, obviously COVID-19 pandemic has shown both the urgent need for strategic health communication and the challenges of doing it well. And within this very challenging context, we used the C4H approach, which I had previously described in our COVID-19 communication response and support for member states. So what does this exactly mean? So from the beginning of the pandemic, we've been applying this approach, including having a regional communication strategy to encourage uptake of vaccines and continued compliance with protective measures, which was grounded in the C4H principles. That means, for example, that we've been using social listening on an ongoing basis, that actually we've used multi-source social listening to shape strategy and messages to have that evidence base. And it helped our strategy to be more impactful. We've been using message testing to ensure that the content resonates with target audiences. We partnered with some trusted voices and targeted communication through channels that we knew that best serve our target audiences. And we have also used storytelling as a technique for people to connect through empathy with stories of others that were affected by COVID, to highlight the human impact of the pandemic and encourage appropriate behaviors. And last but not least, we've had a robust measurement, evaluation, and framework and learning framework to understand what is or what isn't working, and to continuously fine-tune and adapt our strategies and improve effectiveness of our communication. And this is something that we've been doing since the beginning of the pandemic up until now. So we start the communication for health planning cycle with clearly defining what we called a SOCO, or single overarching communication outcome. In this case, there are three, and of course the strategy itself is a fairly sophisticated, complex resource that has also been continuously updated as we continued learning from the various tools about how our approach is or isn't working. But overall, our broader the outcome that we would like to achieve, or that we wanted to achieve as a result of our communication strategy, was for people in the region to understand and feel confident in their country's approach to the rollout of COVID-19 vaccination. We also wanted that people maintain trust and demand for COVID-19 vaccines and routine immunization. And finally, our goal was for people to understand the importance and adhere to other protective health behaviors. So this is just a very quick summary of what the broader goals and objectives of our strategy were. And now I'll hand over to Lika to talk a little bit more about the multi-source social listening.
So in our communication strategy, one of the areas we've been able to gain momentum in and advance in is the gathering of information and opinions and various other data points about how people are thinking of bullying and what questions they have. And this plays an important part in our approach, that we have a good understanding of that so we can tailor our communication activities accordingly. So the social listening that we've drawn has multiple sources, and during COVID-19, of course, a lot of people were online. So the focus was on how to optimize the data coming from social media platforms, using those for gaining insights for our response, just basic things in a way, or what questions are people asking, what information are they looking for, but also how we can monitor and track some of the changes as well in people's knowledge, attitudes, behaviors, and beliefs. So the online listening was complemented by some of the initiatives our partners were doing. Universities, other research institutes were sharing this data, all to help inform the decision making for COVID-19. Platforms would also give access to some of the information around the public use, and all gearing towards helping the response. As Wipro, we also invested a lot in the various surveys that were done in the region. So looking at vaccine confidence and COVID-19 perceptions and behavioral insight surveys. So with all of this, we're really looking to understand, what do people understand about vaccines, where are the gaps in relation to their knowledge, which was very prominent in the beginning. And we saw people really progress in their level of knowledge around vaccines and how they work. Then also with attitudes, how are they thinking and feeling? What are the concerns that they need to address? We continue to see a lot of questions around safety, and we will continue to address that as well. When it comes to belief, it's important to look at the misinformation around how vaccines work, and there are a number of conspiracy theories and anti-vax campaigners that really have strong beliefs around vaccination. So this is also incorporated, and to gain as much knowledge about this as possible to feed that into the communication for health framework. And of course, we're looking at behaviors. Are people getting vaccinated? Are they getting boosters? And how can we motivate them towards getting themselves up to date with their vaccinations? Next slide, please. So when we look at all of these data sources, we want to put them all together and gain insights from them that are actionable. There are two ways that we do this. It's for our catered country support and vaccine strategy implementation in our countries in support of the member states, but also for us internally as WHO for decision making and for the planning of the vaccine rollout. Our goal is very clear. We need to listen to diverse voices. We need to ensure we're including vulnerable and marginalized groups. We need to address the most pressing issues that communities face that can impact behaviors and perceptions, and also triangulate those to make sure we're mapping and filling the needs and gaps in what people are thinking, feeling, and expressing. So aligning behind these goals, we were really able to use the behavioral insights that were being gathered from different sources. We will know that the data is not always complete, but at least with the available data that we were able to gather during the emergency, we're able to make the best possible decision for communications. Next slide. Overall, one of the key things that we were looking at addressing is WHO's the vaccine safety and building trust around vaccines. the social listening really helped us to assist in being vigilant about detecting and reporting adverse effects of immunization. We would provide crisis comm support for countries that were having reports of AEFIs and communities were reacting to those. Being able to manage those effectively and proactively was an area that we supported in, and we continue to see a lot of questions around vaccine safety. Moreover, the emphasis was still on every time emphasizing that vaccines are safe and they offer the best protection. We can share this information and back this up with the science, and we emphasized here on being able to make science easily understood and owned and trusted by the communities, that they understood the information that they were getting, and really improve the quality of health information available to the public, which helped to manage the mis and disinformation that were there. We're also talking about information integrity, which is to stop the spread of fake news, for example, and to make sure that there is an information ecosystem that people can safely interact with, and that they are driven to trusted sources of information, for example. And a lot of good work has been done around this, not only by WHO, but by partners, to increase the health literacy in how people recognize trusted sources and interact with different sources of information to verify and check the facts. For our communication activities, we invested also in message testing, which supported creating communication materials that were highly effective by resonating with the target audiences that were described. So we used a third party who had a tool which would provide short online surveys to test different messages. So really striking the right tone with materials that we were putting out, and addressing the concerns of the public. This is also really much part of our sustained management of COVID strategy, where we need to maintain trust in vaccinations, and especially in the various research pieces that are coming out, questions around the very specific nature of maybe AFIs, or the type of vaccine with different variants and things like that. So we really want to make sure that we're attracting the audience to continue being interested in protecting themselves against COVID. Next slide, please. So when we're specifically looking at managing mis and disinformation, which is where a lot of the outrage and risk perceptions are being influenced, we really have the foundation on having risk and evidence-based analysis and approaches. We need to ensure that we know where to channel our resources to address raising knowledge about a specific issue. We also realized that the importance of delivering consistent and credible messages through multiple channels is super important, including partnering with influential and trusted groups. So our Voices WHO contributes to the information ecosystem, but there are many others who are influential and can share and amplify these messages, and have them be consistent across different platforms is really key. We also realize that we need to be very proactive in addressing disinformation and respond to things in a timely manner. Once there is an information void, people will fill that in for themselves because of the acute nature of COVID. People were really seeking up-to-date information, and needed to hear from health authorities, from WHO, to be able to formulate their risk perceptions, which influence their behaviors. We focused a lot on online, but we also realized we need to go beyond this and employ offline methods so we can reach all communities. Not everybody's connected, not everybody's interacting with social media platforms. So we really need to ensure that there's equity there as well, and that all communities are represented. we really want to look at that two-way communication, that it's not only broadcasting information, but also very much catering and getting feedback on how we can best engage with communities by listening and having them tell us what they need at different points. Building trust is at the center of all of our approaches, where we want to continue earning that trust of the community, that we're providing them the best possible health information and public health advice, and that we also empower them and have a grounds-up approach to be part of the decision-making and understand the processes around emergency response and rolling out vaccines. We really want to leverage as many networks as possible to amplify those messages. And as Anna mentioned before, we realize we need partners, we need to work together. We have existing partnerships, but we're also building new ones and focusing on sharing that information as effectively as possible. Next slide, please.
Thanks, Vika. So just to illustrate some of the communication for health in action when it comes to the implementation of our COVID-19 vaccination strategy, or more broadly speaking, our COVID-19 communication strategy in the region. This slide is a visual slide, and actually it normally comes in a kind of a transition mode, but somehow it's come all together on the screen. But essentially what it is here is a visual representation of our measurement, evaluation, and learning framework for COVID-19 communication in the region. It's a tool, and we've been using this as a tool to monitor how our COVID-19 communication is doing. Are we achieving the impact that we're hoping to achieve? Like I said, C4H is all about impact. So if you look at the bottom of this slide, this is where a whole activity, when we're talking about measurement, evaluation, and learning of communication strategy, this here specifically, of course, COVID-19 communications, we start with inputs and activities. So these are the activities and we're doing or planning to do, preparing, producing, implementing, including social listening, online and offline, partnerships, content development, digital, traditional media, web. And then we move up to output. So this is the activities we put out to reach our audiences. And as we advance through the process, we monitor short-term outcomes, including the initial response and engagement of our audience with our communication and how they respond to our communication. And then as we move along to long-term outcomes, we look at sustainable change. We learn what knowledge or behavior change has occurred. And then this process, of course, is a cycle where we move through stages repeatedly, and insights from one stage are fed into the next one, and so on. And of course, for this framework, we have indicators to measure success at the various stages of the evaluation process. And we've been doing this since the beginning of the pandemic, and we continue learning from this process, and it has been informing our strategy, and we have been adapting and learning as we move along. So, of course, we have a lot of lessons learned, and it's the topic of this presentation today is I mean, we wouldn't be able to talk about everything that we've learned from our measurement, evaluation, and learning process. But here's like a very quick snapshot of some key learnings. So for example, what we've learned throughout 3 years of doing this process is that, for example, we know that there's high level of knowledge about COVID-19 protective measures, including vaccination, but more people believe in rumored means of protection now, or rather, I should say, when the last wave of the survey was done compared to the survey done the year before. But at the same time, people are interested in learning more about how to check and verify the accuracy of the information that they get, according to what we can see on our social media accounts and the measurement and evaluation that we're doing. What we also have learned and what we've observed is that COVID-19, the acceptance of COVID-19 vaccine is high across the region. However, there are ongoing concerns, confusion, and worry, specifically around vaccine safety and side effects, especially among those who are hesitant. This, I should have perhaps mentioned that before. These learnings are based on some of the listening that Lika mentioned during her slides. So we have done 5 waves of CAB surveys in 7 countries in our region. So the findings on the slide are primarily based on those 5 waves of surveys, as well as focus group discussions. And we enjoy high level of trust as an organization. And we've been ranking either 2nd or 3rd most trusted source of information across all surveyed countries. Of course, this is, you know, we're happy to hear this, but this is also something that we analyze in the context of the effectiveness of our communication strategy. And we also have seen that COVID-19 related knowledge, adherence to protective behaviors, and confidence in vaccines is higher among those who are exposed to WHO content compared to those who are not. But of course, we are not saying that there's causality, that, you know, people who see our content immediately become, you know, more adherent to protective behaviors and they are more confident in vaccines. But these findings do show potential contribution of our communication towards these broader goals. Lika, now over to you.
Yeah, so also for the sake of time, I realized we're going a bit over. We of course, from the regional office perspective, we work with various member states and country offices. So we just wanted to quickly highlight 2 of our countries. The country office in Malaysia has really progressed enormous amount in utilizing data for evidence decision making, and they've applied approaches and tools for social listening and make those actionable together with the counterparts to inform the national COVID-19 immunization program. So a lot of work there on trainings, tools development, application of knowledge and theory, and we're happy to share the links which provide more information on the country office there. We also want to highlight that we can't forget the basics. So we need to leverage the powers, as Val showed us, with making materials accessible by having the right format, tailoring communications to specific audiences and languages, so that we ensure that they're inclusive, and especially for hard to reach communities. Equity is really at the forefront of all the things that we do, and making that a priority. So again, our key lessons identified during COVID-19 is about how data and evidence are the cornerstones to inform our COVID-19 vaccine communications, especially to address those emerging trends and concerns in a timely manner. This is how we wanted to demonstrate the proof of concept for C4H, and Anna will talk a little bit more about how we want to sustain on this momentum. So back to you.
Thank you, and this is our final slide. So, you know, COVID-19, of course, has shown the urgent need for strategic health communication and the challenges of doing it well. And countries, as we've seen, you know, some countries have done better than others, but nobody has done it 100% right. And there's a lot to learn from the experience, and we're still analyzing those lessons learned. But within this context, we are, like I said at the beginning, you know, for public health authorities everywhere, understanding the challenges and making the most of opportunities presented by communication for health are increasingly important. Getting the right information to the right people at the right time and in the right formats, as we have learned from our own experience with COVID-19 communication, is an essential area of technical expertise, and that requires investment in people, capacity, enhancement, and funding for activities. So as I said at the beginning, WHO is now working with member states to advance implementation of communication for health as a technical area of work, strengthening the use of communication as a public health tool to improve health outcomes in line with our regional vision for the future. And we hope that through C4H and through scaling up C4H, government, WHO, and partners can use communication to inform and empower, to change attitudes and behaviors, and to help achieve shared public health goals across the region. The final point is that to scale up C4H in the region, we are currently working on the regional action framework on communication for health. And this is going to be considered by member states during the next regional committee meeting in October 2023. And we hope that with the adoption, with the finalization of this regional action framework, it will be a tool for member states in the region to scale up the use of strategic communication and really build on this momentum that has been created during COVID-19. So that's it from us. Thank you very much. Sorry for going a little over time.
Thank you so much, Anna and Lika. And thank you for sharing with us the framework and what C4H is all about and what WHO is doing as far as risk communication, health communication is concerned. I already have a number of questions here from our participants and audience. Now we go next to the national and subnational level. For the national level, we have hold on. Okay, we have Dr. Pahurat Taisuwan. He's a director, Secretariat Office of the Royal Development Projects Committee, Department of Disease Control, Ministry of Public Health, Thailand. She will share with us what have been the best practice or the challenges Thailand had in terms of developing a health communication program and risk communication strategy, in particular, responding to COVID-19. Dr. Pahurat, your turn, please.
Thank you very much, Mr. Landaus, and nice to see you online again. Yeah, hope to see you in person soon. So I would like to share to all of you regarding to Ms. Abby demand me to do that. Thailand investment in health communication. So for Thailand investment in health communication, part of preparedness for public health emergency, especially for the coping with the COVID-19 pandemic. So this is, we have two channels of the investment and also for the budgets come from the government. The first is about fiscal year budget. For the fiscal year budgets of the Thailand occur in October to September, different from other countries. Most of the countries begin in January and finish in December, right? But for Thailand, October to the next year, September. For the risk communication and also community engagement budget is under the projects, under all the ministry, especially for the Ministry of Public Health, mostly the big amount of budgets located in the Public Relationship Department under the Prime Minister office. So you can see the picture. I'm so sorry in Thai, but you can see Ministry of Public Health here. We got like the 7 rankings of the budget support by the government. The green one is 2022. The red one is 2023. So you can see the priorities of the government regarding to the health and public health, including risk communication, is very high. So this is the government budget support for the public relationship and also for the communication. You can see in this chart is billion. You can see it's like at the peaks, highs and ups, but it's very high. Thailand got budget support for the public relationship and also for the risk communications about 2 billion Thai baht. The last year for the 2023, we have 2.492 billion Thai baht. So look down for the 2 billion 2 billion Thailand baht. You can see most of the budget located in the raise public awareness regarding to not just for the diseases, but also for the people perception regarding to the government. You can see is a huge number right here. So how has the funding from the health community for public health emergency increased during the COVID-19 pandemic? As I told you, we have the fiscal year budget, and also we have the central budget from the government too. For the budget, for the fundings for health communications, I think increased, not decreased, but indirect budget for the health communication more than the direct. For example, the government give the money, give the budgets or funding regarding to support, create about the application or something else, database or data warehouse to support about risk communication and also for public relationship. Yeah. So this is give you for example regarding to the government central budget coping with the COVID-19. Here, it's just for the 3 months at the beginnings of COVID-19 outbreak in Thailand. The central government support the budget about 17,000 million baht for prevention, control, treatment, and also for the healthcare facility, vaccine, procurement and management, staff fee, medicine, PPE for the hospital quarantine, community quarantine, and also for the risk communication too. This is the budget or the investment and also for the funding with the Thai government support for the COVID-19 to coping the emergency, coping with the pandemics during 2020 to 2022. Totally is about 440 billion Thai baht to prevention, control, treatment, healthcare facilities. Almost of the budget is about 59% to prevention, control, and treatment. For the risk communication and also research and development to all sort of things, about 10%. allow that. Not just for the government, but also for the economics, ELA, and also NGO, international organization support Thailand to coping with the COVID-19. Your light has now, you can see this is the university support the budget to coping with the COVID-19, not just for the treatment free or control free prevention, but also for the risk communication too. I would like to give an example. Thailand got many of the support by the international organization, for example, like a World Health Organization regarding to the risk communications. This project is the COVID-19 support for Thai people and migrants in Thailand. We have many of the measure, not just for the risk communication, but risk communication is a subject with the World Health Organization support. For the risk communication, we would like to enhancing risk communication and community engagement, and also as a bit of the information intelligence center. You can see here, these are all activity and output of the WHO support. I do down for the risk communication with the WHO support. We have the 4 activity. The first things about here expertise for infodemic management, and also for less awareness on the social media. For example, like on the Facebook, on the Line, on the TikTok, on the Instagram, where the Thai lose COVID or Thailand know how to fight with COVID-19. And the second things about develop and integrate database, especially including with so people perception evaluations, and also for situation occur, including for the social media monitoring and response to. The third things about develop and procure communication material, printing and electronics material for migrant. We translate from Thai to other languages, for example, like a Myanmar, like a Lao, like a Cambodia, and also for English and Chinese. And also the last thing is about develop about vaccination websites for the foreigner in Thailand too. So now Thailand prioritizes in terms of the strengthening the country health communication capacity for health emergency. In Thailand now, we call like a Thailand digital government. The Thai government, they set up the Thailand to be the digital country. So we have the purpose to serve and purpose. The last purpose or the last objective is about the strengthening about the communication, and also for the risk communication for all of the government organization in Thailand. This is why we have to set up about e-government or digital government to integrate all of data in the every department organization in Thailand to smart operations, to driven transformation, and also we need to look at the citizen like the centrics of the civic. You can see in the red in your right hand side, this is the government support for the Ministry of Public Health to strengthening about the communication. So from now, we need to mention 3 things. 3 things for channel we need to public or communicate with our audience or our people. We have to using the free social listening and short video for risk communication because of us. Because of by now in Thailand, we have some burdens about the budgets regarding the COVID-19 outbreaks, for example. So this is, I would like to show some of you is a kind of we prioritize, sorry, to like raise awareness of the society regarding to the disease and also for the risk communication. The first thing, free social media platform which we use by now. For example, like a TikTok. TikTok is the last the last channel we use because of what in the past we thought TikTok is a kind of the younger, is a kind of not, we can give the knowledge to the publics, but by now everything is located in TikTok. So we have to investment not just for the mainstream media, but also social media, especially for the TikTok. So what we investment on TikTok, not just about the advertisement, but also for the produce, the clip, the short video, for example. And another thing is about we concerned to augmented reality, both virtual reality and also for augmented reality for the younger people who are concerns about the new technology more than the older. And we have to use about AI or the artificial intelligence to assist us to risk communication because of what? Because of we have to trying together two-way communication. By now, not just for two-way, we need to concerns about two-way communication, about the officer to the audience, audience to officer, and audience to audience themselves. Why not? We learned too much regarding to COVID-19 coping. We give the information to the healthcare volunteer to transfer our message to the villager. We found that it's very efficient, and also we can control of COVID-19 in the community more than the healthcare provider or healthcare officer who give the message to the villagers. So maybe they are familiar and they are located in all of the community. So why we have to concerns about two-way communication, and we would like to information, the facts information is occur in the society from the audience to each audience to other audience to in their community. Yeah. So how the government to sustain or increase the pandemics induced investment received by the health community. For my experience, I respond to many of the diseases outbreak, especially in the risk communications aspect. For the government investment, the area for health communication, we need to use the emerging technology for risk communication and community engagement. Two, monitoring both the mainstream media and also for the social media and for the people perception. The second thing, we need technology to analyze, predict, presenting, warning, and also respond for the misinformation, disinformation, and also for the rumor occur in the society. And the last, we need the technologies to evaluating all of the things from the beginning to the end of the risk communication. So for me, regarding to the health communication, which government need to investment, the first things about the data warehouse. The data warehouse, which includes or indicate about situations, about the people perceptions, and also for the social media, mainstream media together, telemedicine, social listening, and also for the deep learning machine. The last thing is about chatbot, but for me, chatbot is not like I need the people chat more than chatbot, but however, some people they need about the real time, the fast. In case of the people, maybe we have like a human error and also the burdens of the people, their fatigues in case of they communicate or they work too long. So this is yeah, I think is so this is my last slide. If we have to investment and also for use the technology for coping with rumor, misinformation, disinformation occur in the society, and coping with health emergency. We need to exhibit. First, we have to exhibit, and then using, we have to cover it all over thing. We have to update about the technology you use, and you have to evaluate all of the process and reconstruction. If you found something need to review. So this is my I would like to share about investment regarding to health communication. Thank you very much.
Thank you, Dr. Pahurat, and nice seeing you again. And
Yeah.
next time, yep. And this time, we'll have at the subnational level, City Government of Navotas. She's currently the city administrator and council representative of the Asian Oceania Federation of Obstetrics and Gynecology Board. She was also the 2020 president of the Philippine Obstetrical and Gynecological Society. Friends, we have Dr. Cristia S. Padolina. Dr. Cristia, your turn.
Yes, good afternoon, everyone, and let me share my slides. Okay, I think to better understand how health communications was handled during the pandemic and how it is better handled right now, let me walk you through how we handled the pandemic and how we are navigating the current situation and how we have involved health communications on this response. So the city of Navotas is a highly urbanized city with 250,000 population. It is considered to be the biggest port in the whole of the Philippines. We are surrounded by bodies of water, and we're a small city, highly congested. And out of this, 20% of the total population is considered to be depressed. When the pandemic struck, let me borrow a quotation from Lord of the Rings. We wish it did not happen at our time, but it did. And so we responded by appropriately giving our best in terms of handling the pandemic and moving towards the normality or regularity of things. We have now a summary of the COVID update of the city of Navotas. We had a total of 22,287 cases, with 731 of those ending in deaths. That's a whole lot for us. And we have the smallest unit of our government is referred to as barangay, or that's the smallest, or village in some parlance. Now, we referred to in terms of branding and communication, we referred to our response as the City of Navotas COVID-19 response, so that everywhere we go or in any platform that we tackle, this is the byline and the branding that we have for our community. Baseline or foundational knowledge in terms of health communications would be leadership and governance. We had to ensure that there is only one talk that is being initiated from top to bottom, regardless of the media that we utilize. So these policies came in very timely, and up until now, depending on the national status of all events pertaining to COVID, and at the same time, specific to the availability of the vaccines that we have. This is the current status, and please take note that our thrust right now is to zero in on the vaccination of the senior citizen and the pediatric group. But moving forward to the current situation, there are also some things to be appreciated, not just COVID, especially that we're now navigating the new normal. And this is the collateral advantage of the vaccination program through communications. The Philippines is quite unique. We had problems in terms of one of the vaccines in the past, and therefore this was an opportunity for us to open our doors to other vaccines other than COVID. So the confidence, we're building up on the confidence on all of this so that we will also be able to cascade other vaccines in terms of delivering our message. So the message is quite clear from, if you would take note of the directions that we took in terms of leadership and governance. We think that we cannot handle the whole situation unless we capture the whole community, as they are headed by what we refer to as barangay captains or village heads. And therefore, what was undertaken was a daily meeting in anticipation of the COVID. So from 2020 to 2022, although we're doing it now on a weekly basis, at the time, we were doing daily communications no matter the time, but we usually do it at 4 o'clock to 8 o'clock in the evening, wherein it is an opportunity to deliver the message that we're quite serious in handling the COVID and quite serious in reaching the smallest communities, even in the smallest tributaries of our street, in terms of giving the vaccine. In our meetings and discussions, never did we have any speaker other than a physician to do it. Although it is moderated by a political head, all our communications were handled by a physician. In this way, we are assured that we have evidence-based and information that is really backed by science in all our undertakings. So the health education, information, motivation campaign were really geared towards changing the behavior of the community. It's difficult to convince the community of a virus. It's something that they couldn't see, and yet they're seeing their relatives and acquaintances dying. So it is quite important for us to provide a communication to the community that is not just one way, but also bidirectional. The last bullet on the left side, which is the use of text JRT or text 2B, means that they are able to send SMS directly to the local executive, to the mayor, in order to further clarify whatever messages we have. We have weekly, we refer to it as a FB or Facebook situational, wherein timely, we take in messages, we address their concerns directly, and therefore, during the time of vaccination already, as shown by this one, there was a clear navigation of leadership as we had our elections last 2022. In this way, we are assured of continuity, not only of how we respond to COVID, but also on how we give out our communications. And I think this is part of reaching out to the community. We're doing something. This is how to manage it. But you are part of the solution by having yourself vaccinated. We also provided, it would have been advantageous and practical if the national government had its own website or consolidated the efforts. But right now, because of the red evolution that we're having, it's the LGU who takes care of its community. So in this regard, we developed our own, we refer to it as a COVAX website, wherein the community themselves could choose which vaccines, which facility to go, when do they want to go, as long as they register online. It is also this opportunity that we reach out to them and also tell them the pros and cons of the vaccination. In this way, we shorten the time that they go to the vaccination center. The picture on the right side is a couple, 100 years old and 101 years old, who had their vaccines. And when they were interviewed as to the clear communications why they went into the vaccination, it was because of the videos that were made in order to convince the community that this is the way to go in terms of protecting not only themselves, but the family and the community as well. And we established the Navugabay, the Navotas Obscene or Operation Center. It's enhancement of the telecommunications so that there would be a telemedicine platform at any time of the day and night. Of course, right now that we're opening up more services, we have navigated through this one, but we maintain this on a smaller scale because we feel that there are now concerns over COVID vaccines, especially that we are now approaching, let's say, other vaccines and the bivalent, so that we will now be able to set the stage for a faster communication with the community. This is a partnership that we've had in terms of other aids other than coming from the budget of the local government or national government, wherein we were able to utilize other means other than social media. Because when you go to the tertiary streets, they're not techy enough. They do not use their cell phones. They do not have cell phones. They do not have this facility. And therefore, it is a mechanism wherein our members could go house to house, deliver the vaccine, deliver the message. We set up television sets in the barangay so that we will be able to reach them in this manner. So what happened in the past is the school closure. And somehow for mental health also and for appreciation of why vaccines is needed in terms of health communications, we had to do it sometime in a facility wherein we don't use social media. Okay, so basically what we're saying, we tried to individualize depending on the market share, depending on the patient population that we're currently reaching out. Okay, but of course at this time we've opened up all classes. They're now face-to-face, and we've maintained, of course, this communication still. The vaccination for the adolescents started in October. And instead of the usual protocol that we've had for health communications and messaging, our health communications this time, because it's a different population, we urge them to go with their other friends so that we will be able to depend on a faster coverage for all these school children. Okay? This is the scheduling that we did before. And right now, all our vaccination, instead of having big vaccination centers right now, is part and parcel of the services that are delivered in all our health centers and hospitals. Now, how do we move forward in all of this? This is still part of our FB page for the city. We wanted to showcase that we do not want to go back in the past, wherein we would have the swabbing, we would have the isolation center, we would have the quarantine ban so that we know that we keep them in that particular area. This is a reminder for everyone. We don't want to go back to this specific time anymore. And somehow we still receive comments in terms of the COVID. We don't want them to be fully complacent of this situation, in as much as situation might escalate at any time. So uniquely to the Philippines and to the subnational level, we're dealing with two things right now: the implementation of the universal healthcare and the revolution in the LGU. But definitely, we appreciate that the LGU, or the smallest unit of the community, is responsible for its people. And therefore, we would like to align that messaging that we take care of them. We wanted to prepare if and when and prevent any other pandemic. And therefore, we are still keeping on our toes, and we are also securing all necessary precautions in terms of the health communications. We have maintained that open communication, social listening, and adopted and provided budget, and hopefully we will be able to utilize and go forward with what we refer to as a digital city for Navas. Thank you very much.
Thank you, Dr. Padolina. Thank you so much. And now we open the floor for questions and answers. Sarah, Abby, do we have questions from the other participants? Actually, there are two sets of topics. The one is on strategy and programs, and the other is in investment, possible investment in communication, health communication. If there is none, okay. I'll start with a question on Ayako. During her welcome message, talked about complacency and a certain level of vaccine fatigue. So this is for Anna and Lika and Dr. Pahurat and Dr. Padolina. Has there been some changes in the direction of risk communication or health communication in general? No? Given that there's now less mask usage, less social distancing, given, for instance, in Thailand, Bangkok has opened its doors to everyone, and if will there be changes in the direction of the communication program for COVID-19 pandemic? Yes, Lika.
Go first, thanks. In terms of risk communication, yes, definitely there's been a change because for COVID response, we're coming out of the acute phase into more the sustained management of COVID, considering that their lifting of measures for public health and social measures, the people are in a way resuming normal life, and in that the message is also different, where vaccinations are still very, very important, and that you need to keep up to date with your vaccination. So from member states, we're seeing the communication activities being centered around boosters and being able to sustain the immunity levels through the vaccination. I think as WHO, there was the strive to have all the countries have primary dose, 70% of their population vaccinated, which most countries have reached in the region, in the Wipro region. But of course, it doesn't stop there. We need to continuously work on messaging to get people to have their vaccinations up to date, and including the boosters. So definitely a shift also in messaging, because people are tired of hearing about COVID. So with the message testing that we've done, appealing to people's sense of understanding their own risks and protecting themselves and others, that still works, but we also need to make sure that people start looking at it as a habit or a norm, that you need to have your vaccination up to date to protect yourself from getting COVID. So yeah, I hope that answers your question.
Okay. Dr. Pahurat, at the national level, would there be changes in your strategy, communication strategy?
Yes, I think for the COVID-19 and after COVID-19, I think it's like a risk communication disruption. Both disruption because of the first thing, information. The second thing is about the channels. As we learned when we are the younger, right? Communication theory is about SMCR, right? So
Yes,
by now
right.
the audience is changed. the message is a change, and also for the sender is a change. The new thing occur, new channel, new technology, new audience. The new audience is very, very difficult to do talk with them because they are the high digital literate. They are high digital literate. So they are the big group. They can public the fact and also the fake. They can public about fake themselves. So after COVID-19, we change the direction. We mentions all of the audience, not just for the majority in Thailand, but also the minority in Thailand, not just for the Thai people, but also for the people who living in Thailand. We have to keep update. That we have to keep an eye to all of the group. Maybe just a little guy, just a small group, it can make like a big thing who affect to the risk communication and also for the touch of the government, the touching of the, for example, like a COVID-19 vaccine. I found, for example, like a mRNA vaccine, just a doctor who says something. So people in Thailand, don't would like to get the booster dose of mRNA vaccine, just for example. But by now, Mr. Landop, Thailand still wearing masks because of not for COVID-19, but for PM.
No, because of the smog.
Yes. Okay, thank you.
I know. Thank you, Dr. Pahurat. Dr. Padulina, at the subnational level, at the city level, would there be changes in the messaging, given that we are living the new normal?
Yes, I think there are two drivers for the change in messaging of at the sub-city level. Number one is the fact that there are now an urgent need to open up other services. And since this is the call, we need to have budget for, okay? And at the same time, we're fully dependent on the Ministry of Health to provide and give us vaccines. And I think that is the prime difference between a subnational level and a national level in terms of creating priorities. But be assured, however, that we recognize the messaging and therefore we tweak it depending on the needs of the city.
Okay, thank you so much. Before we go to the questions from the audience, just one last question from me. As an ordinary citizen, I had 2 booster shots already. All right. Question is, how many boosters do we need to have, to prevent ourselves from, catching COVID and given the variants? And would this be an annual vaccine deployment mobilization? And what is the vaccine efficacy time in terms of the efficacy in terms of time? So, Dr. Padulina, maybe you can. Do you still have a vaccine campaign in Navotas?
Yes, the setup in the Philippines is that we have a special agency that takes care of this. Okay, so what is being cascaded to us is now we're still waiting actually for our bivalent vaccines. We've heard stories that it would be on an annual event just like the flu vaccine. But we have continued, let me chat for a bit. Aside from being a public health advocate, I am also part of the Philippine Obstetrical and Gynecological Society. And in this regard, we're still continuing our research on both maternal care and pediatric care in terms of the impact of COVID and vaccination. It is therefore on this vein that the communication still persists. But of course, we cannot issue statements other than the Ministry of Health. Thank you.
All right. Lika?
Thank you for your question. I am not a medical doctor, but I think this starts at the heart of the work that we do. These are the questions that people are asking, and we have teams working on providing answers to that. our lesson from COVID and where we need to build momentum is that we need to make science accessible. We need to have people understand what to do because the science is telling them that this is the best approach. We know that with COVID, there's still a lot of lessons and there's a lot of people working on trying to give the best guidance. And when that information is available, sharing that with the public. So the question you have is a question that many others have. And we need to, as communicators, work very closely with our colleagues to ensure that those materials are available. And as WHO, we're continuously working on providing those guidelines and amplifying the knowledge that we have. And once that guideline is there, we as a team of health communicators say, let's break this down. What does this mean? And find the right ways of channeling it to the right target audience and the right methodologies there.
Thank you, Lika. So okay, these are questions now for Anna and Lika. Based on your work with countries, the status of their respective capacities in health communications and the requirements of the pandemic moving forward, where should the countries focus their investments in these areas?
I can start and then I'm sure Anna will have a few things to say as well. But so from a risk communication perspective, we know under the international health regulations, we've said the risk communication, community engagement is one of the core capacities that member states need to have to protect themselves when there is an emergency. So it's been defined more and more what that means, what are the elements that need to be in place for risk communication and community engagement. So as WHO, we've developed a number of tools to help assess that capacity or to evaluate for member states to understand where they are. And within that, I think quite specifically in the last year and the lesson from COVID is how do we continue sharing information effectively in the new information ecosystem that we're in. People are much more online. The use of mobile is becoming predominant, and there's a recognized problem with the spread of mis and disinformation, where the emphasis is on providing quality information and guide people to recognize when they're following the advice of trusted officials and knowing what the right thing to do is. So within the systems, as WHO, we're really emphasizing the continued investment. We know that a lot was built up during COVID, and as we saw in the previous presentations as well, how you organize your team, what kind of materials you're putting out. Just also a question, do chatbots work or not? Is it something effective? Those are decisions that are part of the system that you have in place for emergency preparedness and response. So that needs to be sustained. We're not maybe responding as actively to COVID right now, but we need to be ready. I know we don't want to talk about it too much, but there could be a variant or there could be a new emergency for us that we need to respond to. So really keeping the system, looking at where we can strengthen that further. The introduction of social listening to address disinformation, and as Anna was highlighting as well, the foundation to build the evidence for the communication activities that we have.
Thank you, Lika. There's a question here for Dr. Pahurat. I think it has something to do with Thailand's digital government. We see from your presentation that Thailand's prioritizing and investing in technology, but it also showed that the health sector has the lowest investment so far. Okay, so what is the Ministry of Public Health doing in terms of advocating for more investment in this area?
Thank you very much for the questions. It's a very good question. Because of what? Because of you can see the highest rankings of the fiscal year's budget. Ministry of Public Health is very high, and we also include many of the budget of the risk communication budget located in each project. So it means this just at least because of other ministry, they has not like a risk communication or digital literacy in their project before. But in Thailand, we include already in many of the project. For example, like risk communication, we got I think every year we got more than 100 million baht per year for regular risk communication and less rated, and including for risk for health literacy. This is just for the infrastructure. It's not kind of risk communication procedure. Infrastructure, for example, like building apps about internet, wireless Wi-Fi. So, for example, in Ministry of Public Health, we are building this before COVID-19. So why for the digital government, why Ministry of Public Health got the less amount of the budget? We include in other. And you can, for the other ministry, for example, like Ministry of Education or Ministry of the Digital himself, because of they have to building infrastructure. It's a kind of the big project to support other minister. So why they have got the highest amount of budgets. Yeah.
All right. Thank you, Dr. Pahurat. Next is at this point in the pandemic, how does the financial allocation for health communication look like now at Navota City? I mean,
Okay. In terms of percentage of budget allocation, the health still ranks number 1 in terms of allocation, 20%. The risk communication at that point in time is part of the total budget. And we're looking into supplemental budgets as needed, which means that as per direction, we have utilized national, we're entitled to a national counterpart of our budget, and those were forwarded for infrastructure. But still, health maintained its allocation of 20% compared to the other departments, because we still feel that we need to have a buffer or a backup for all other activities to support this one.
thank you, Dr. Padulina. One last question for Lika. Lika, given that there's now changes in terms of being able to cope and being able to address effectively COVID-19 pandemic, can WHO be able to help countries in terms of developing business cases for countries who would want to enhance their health communication strategies and programs, not just only for COVID, but for future public health emergencies?
Very interesting question. So at the moment, a lot of countries are formulating their national action plans for emergency preparedness and response. And within those plans, they allocate what the priority activities are. And we continue to advocate that risk communication and community engagement is a vital aspect of being able to respond to emergency preparedness. We need to continuously advocate within this as one of the areas of those national action plans that it's a priority to continue investing in communications. I think COVID has really taught us that. And in terms of developing a business case, this is the approach is really highlighting our successes and our contributions to an emergency response, and being able to capture the lessons identified during COVID, and documenting those, and therefore feeding into how the national action plans are being formulated. And how those national action plans will be funded is also then one of the next questions for a lot of member states. So overall, health is still a priority, and we need to have ourselves aligned what we need to be doing, both for preparedness and response. So that's a process and phase that we're now in.
Okay. Thank you so much. I'd like to thank our resource speakers, Dr. Padolina, Dr. Pakurat. It's nice meeting you again, Lika and Anna, who are in Manila. Happy holidays very soon, and happy Songkran also, Dr. Pakurat. I'd like to, before we close and get and have Dodo do the closing remarks, I'd like to thank Sarah, Abby, Shek, and Mark for organizing this webinar, and the ADB events management team. Dodo?
Yeah, thanks. Thanks, Randy, and I think thanks to our speaker, to our friends from WHO, from Chris Jasmine. Hello. Been a while since we saw each other. Pahurat. I think it's really great to hear the things that's been happening in health communications. I think we in ADB, and I think our friends from WHO would love to hear this, are really trying to explore in ways in which we could mobilize more resources to support countries, not just, of course, in WIPRO, but in Sharo. Well, we were invest in health communications. We have seen how health communications was very critical in addressing COVID-19 and for future pandemic. We have seen how much more creative we are now in this world of digital communications and all that. I really like the presentation of WHO, the way you have been presenting it, the way you're attacking it in a very systematic manner. Sometimes a lot of people, as long as they communicate, says it's already health comms. It's more than that. We have to be, that's even a risk. Sometimes it's a danger because, and as you have seen that, very good communicators, unfortunately, if they're convinced of wrong things, it becomes a problem for all of us. So we're looking forward for more collaborations with Anna and Liki. I think there's really a move among our bosses, our top management for WHO and ADB to work more closely. So looking forward to that. And I'll try to push, of course, within ADB that we focus among other areas. Health counts. Unfortunately, it's not on the table as I hear the discussions, but I think this is something that we should be bringing in from our part. Hopefully, it will also be picked up by others. Looking forward to work more closely with Paurat. We have deepened our engagement with Thailand during this pandemic, and looking forward to see you. And of course, we are supporting universal health coverage here in the Philippines, Christia. We visited Valenzuela last week. I think I should have been in the other town, Navotas. Have I known that you were there? Just learned quite recently that you're there. But nonetheless, looking forward for more engagement with LGUs in the future. So we'd like to thank everyone. Health communication, I think, is underutilized resource in the health sector, in the health systems, even in the UH discussions, in the health security discussions, and we look forward to basically change the minds of a lot of people and countries. So thanks everyone, and bye-bye, and enjoy if you're in the Philippines, enjoy the long weekend. I think for a lot of people, the weekend starts today. Next week is Holy Week in the Philippines, so there's still work Monday to Wednesday, but a lot of people I don't think will be having the holidays. And Anna and Lick, you're also in Manila, so yeah, enjoy minimal traffic in the next 3 days. And Parat, enjoy Sukran, and I'll be in Thailand on May, so I hope to see everyone. Bye-bye.
Bye-bye.
Thank you very much. Bye.
Thank you very much.
Kapun Kap.
Bye-bye.
ขอบคุณค่ะ